Okay, so we are on day 3 of stiff upper backs. We talked about day 1. I'm just turning my noise off on my phone, so hopefully it shouldn't go off. We talked about on day 1 the ribs and how sort of the movements in your thoracic spine, so your actual thoracic center of your body, is restricted in the amount of movement that we have anyway, purely because the way that the ligaments and the joints are organized, but also the fact that they have the rib cage attaching onto them. Also, we have the shoulder and the shoulder girdle, and the purpose of the middle section of your spine, so the thoracic spine, is to really protect your vital organs, which means that individually, all the tiny little movements that our joints have in that area all accumulate up to give us mobility. Okay. We also talked about the fact that we all sit and we're all a little bit more hunched than we should be. Certainly we're nowhere near as active, and we don't need to do as much intense labor as we used to. So just general things like housework, pushing hoovers, driving cars, everything's a lot easier for us. We have a lot more power assisted steering. We have a lot more just in general day-to-day usage, hoovers and vacuums that work with ease, as opposed to us having to haul heavy things around. And then with the age of technology, we do tend to be a lot more static. We're not having to get up out of the chair to go to photocopies and do things. Everything that we want is pretty much on our laptops, on our keyboards, and we really are just pressing a few buttons, and we can basically sit down at 8 o'clock in the morning and not get up till 4 in the afternoon, and pretty much everything we need is there. So that has had a big overlay on how our bodies then function. We're a lot more static than what we used to be. And definitely previously people would say, I'm glad I don't do a fairly physical job. I don't know if I can manage doing a physical job, whether it was plumbing, labouring, bricklaying, something that involves a lot of actual manual labour and hard labour. To be honest, they're probably better for you at the moment, because they mean you're up and about and you're moving your body, where when we're static and we're sat, we're really not moving that well, so we're leaving ourselves prone to other issues and other problems as well. So today we were going to go through, predominantly if we're hunched and we're slouched, our pecs will get tight. Predominantly if we're hunched and we're slouched, we're going to sort of be higher in here. We're going to find that our rhomboids, so the muscles at the back of the shoulder blades, are on a stretch, and generally everything sort of shortens and tightens in our upper abs. So today in our little treatment, one of our treatment rooms, so hopefully you'll be able to follow me along. So pecs, if I grab our skeleton here, you can see the pec muscles. So our half of the skeleton here, that's our little baby skeleton. You can see the coracle process on here. Those attachments of your small pec minor muscle attaches into your first couple of ribs through here. Now, as they get tight, so they're starting from here, they attach into here, they curl my shoulder blade forward. As my shoulder blade curls forward, I'm going to find that if I can normally lift my arm with ease through here, if my shoulder blade is forward, it's going to start getting caught and impinged on here. And that's when we start getting problems like shoulder bursitis or rotator cuff issues. So if you're finding that your shoulder's starting to get pinchy when you pass through 90 degrees, you might find also, if you're hunched forward, that what you've actually lost is your normal natural range of movement through your shoulder, and holding it backwards and then seeing if you can move it might be a good way to check, does it still hurt? And then what's happening is there's maybe a bit of an impingement going on through there. So we're looking at targeting the pec muscle. So think from the point of your shoulder in front, you'll find a bit on there that's a little bit sensitive, and there working down towards your nipple line is what we call your pec minor muscle. So it's a short little muscle. If you think about lifting yourself up from under your armpit, where that palm of your hand would sit is probably smack where your minor pec muscle would be. So if I'm going to use this door here, or this bit of window here, if you guys can still see, I'm going to put the ball in here, and then I'm going to lean against there. And that area there is where that pec minor muscle will sit. So if I'm holding, and imagine I'm behind the door, I'm basically looking for a small area of tightness in that muscle. Okay, I'm going to hold the contact there, and I'm going to start to move my arm up as I get a little bit of release. Okay, so if I just go back behind the door through here, I've got the ball in the right spot. I'm using the back of a wall so that I can get my chest free. And then if you can see my arm through the window, as it gets easier, I can lift and place my arm up, because then my arm's going to be on more of a stretch. Okay, that is the easiest way to find pec minor in a standing position. Okay, you can obviously do some basic stretches where you're here and we just turn around. So these are what we would deem stretches. Your elbows here and we turn away. So the difference is when we're doing trigger point release, the trigger point area is targeting the muscle that's tight. So we're pressing into the muscle. We're holding it for maybe 10, 20, 30 seconds. The muscle will let go and we'll get a little bit more range. Then we go to the next spot. We hold it 10, 20, 30 seconds. The muscle will let go and we get a little bit more range. When we're working with stretching, we're literally just stretching from the origin of the muscle to the insertion of the muscle, and we're holding it on a prolonged stretch. Again, we're holding it 20, 30 seconds, and then hopefully with each stretch, we're able to get a little bit further. The big thing is that if you're using the trigger point, you're actually able to target the tight section in the muscle. So we're able to target where it's tight. You could even do what I'm doing here, just find the different fibers and find the bit that goes out and just hold and press. If your arm's down here, you're going to find it's a little bit easier because you haven't got that stretch on it. As you move the arm out, you'll find you get a little bit more stretch on it. Okay, so your pec minor is quite a short muscle. It interdigitates over a handful of ribs, but it's the one that pulls the shoulder forward. Okay, if it's tight, when you try and pull the arm backwards, it's going to restrict you because it's attached through the ribs. Okay, your big pec muscle comes from the edge of your clavicle here, so your collarbone. It comes from the edge of your chest. It covers your sort of whole expanse of the chest, and it interdigitates or inserts into the bicipital groove, which is just on the humeral side here. Obviously, it's coming in that wrap position. So if you come and have a grip under your arm here, so if I just show you here, and I'm gripping that section there, that's my pec muscle that's coming through here. And that's my big pec muscle. So that's my pec minor or pec major muscle, sorry. So it's going to have a clavicular head, which is the section at the top, and it's going to have a sternal head, which is the section here. And then it all merges together into insertion in your bicipital groove. Okay, and in that position there, I'm on a stretch. If my pecs are tight, I'm going to end up pulling, and you're going to end up seeing all the tightness through the pec muscle through here. Or as I move and I'm trying to move my arm overhead, it's going to be tight and it's going to be restricted. So you're going to see that restriction through the muscle here. Okay, same principle. You can do the turnout and you can do the arm behind the door to get them stretched. But if you're focusing on the shoulder joint and the pull of the shoulder blade, and the pull of the shoulder blade forward into that hunched position, you need to target pec minor. Okay, pec major here does obviously have an attachment onto the collarbone, but your pec minor has the attachment onto the shoulder blade. All right, so that needs to be targeted. So if all you're doing is trying to put your shoulders back and doing some stuff this way, you're missing a big section of muscle that could help you. Okay, second section that tends to be a little bit tight. So as we're nice and upright here, we get pulled forward with our pec here. We get tight through our scalenes, which we're leaving for another day because they're hard to be getting at. But you'll find that your upper neck muscle, so your occipitals, and obviously your upper traps become shortened as well. So we have different ways that people use their upper traps. Some people might use a ball and they use them as a bit of a ball section on the upper traps. Some people use things like the knobbly ends of the sticks. So this is a stick from Rebel Sport, and you can use that to get into some tightness through the muscle. You just need to be careful around your neck, because obviously around your neck you're starting to get into different areas, and definitely the front of your neck there's some very delicate tissues and blood vessels that you don't want to be messing on with. But in that sort of bulky section at the top of the hair, rather than coming forward in that sort of section through here, you're going to find you're able to get into some of that upper traps, maybe into a little bit of your supraspinatus muscle, which is the one that holds your humeral head in place. Okay, so some people will just actually use their fingers and they'll actually go, oh, that feels good, and they're moving their arms around, or they might sort of do a little bit of rubbing and pinching along that shoulder. What you can do if you're using a ball or even one of the small balls is think about that being at the top. Imagine there's a little headlight sitting on the top, or if it's a smaller one, a little headlight sitting on the top. And it's easy then, same thing again, to come through the door, and you want to hold that ball in place, and you can move your head away or rotate it away. And then again, you're just moving your body along the edge of that wall to see where that tightness is. So what I've done is just literally use that against the wall and then rotate it or side bend my head away. Sometimes you might just prefer to use the ball along that shoulder. So again, excuse me, remember what we're telling you to do, or what we're demonstrating or explaining might help, is something that really you need to get checked with your healthcare professional. So if you are in a lot of pain, I would definitely make sure that before you try any of these things, you've actually checked that that's your problem. Sometimes, referred pain down the arm or referred pain from here can be coming from your neck. Sometimes referred pain through here onto the shoulder could actually be a rotator cuff problem. Sometimes referred pain down the arm can actually be a shoulder pain problem, as opposed to just coming from the neck as well. So it's always worth, the best management strategy that we have is making sure we're managing the right thing. And if you're managing a muscle when it could be a joint, and you're managing a joint when it could be a muscle, you're not going to get the results that you're after. Okay. The third issue that we have when we are in that hunched over position and stiff through the upper back is that all these little joints at the back of the spine connecting onto the ribs, and we have all the muscles on top. They're working on a long length. Okay, the easiest way, if you're looking at some muscle release, is to have your ball and you want to place it between the section here. So we're not on the spine, so the knobbly bits on your spine, you want to stay off those. You want to stay off the edges of your shoulder blade. You want to be on the section between, which is where your muscle bulk is. Okay, so you can just get that here. Oops, a daisy. Let me turn. I nearly took my computer and laptop off the table. So I'm then leaning against the wall. Okay, and it's hard to do it this way because sometimes we lose control of the ball. So the easiest thing to do, if you've got a pair of stockings, or I've got one of the kids' old rugby socks here, is to actually place the ball so it sits in the bottom of the rugby sock. We're looking at targeting not the spine, not the edge. I'm looking at targeting the areas in between, and then I'm holding the sock, and then I'm leaning against the wall. Okay, so I can bend my knees to come a little bit higher up, and I can straighten my knees to come a little bit lower down. And what I'm looking for is that sort of section that feels a bit ouchy. Okay. And then when I feel that ouchy section, I'm just going to breathe. Now, if your arm's quite sore or you feel heavy in the arm, you can give it a little bit of support, so you can hold the arm for support. We don't want the arm back here, because as soon as the arm comes back here, you're closing the shoulder blade over it. You want the shoulder blade open. So I generally have my arm forward a little bit, and then I'm looking for the sore spot. Good thing about this is I can drop it a little bit and find my target, and I can use it to pull it up if I think, oh, that's too low, it's not where I want it. And then we find where we're sore, and just some take breaths in. Remember, we were talking that as you breathe in, the ribs have to arch backwards. So if you want to help them, as we breathe in, Lift the arm up. As we breathe out, arm comes down. As long as we're not arching and moving our whole trunk, as long as we keep the rib cage still and we just move the arm, that will help. You can place the hand on the opposite side and track the ball around the rib, okay? And that will help too. So what we're looking at here is we've got the ball centered. As I move the arm up, the ribs expand, and as I come down, as I'm going side to side, I'm just tracking along the section of the rib. You can see on this one here that we've got the line of the intercostal muscles. Now, if those intercostal muscles are tight, they're going to pull that together. As we breathe, they stretch, they close, they stretch, they close. So as we breathe, the ball helps them expand and close. So, just lost my mic as well. I'll put my mic back in because I'm all out of sorts today. I've got my car in for service and I've left all my equipment in the car. Ribs. Pec Minor is going to pull you here. So if you're hunchy at the shoulder, you're going to need to release Pec Minor. As Pec Minor pulls forwards, these muscles are getting tight because they're short, because normally they live down and back, and now they're being pulled forward and up. So you're going to need to release some of these as well. You are also going to be tight with your occipitals, which we haven't covered today. You also may be tight through your whole big pec muscle. Again, that's the whole area through there as opposed to just the pec muscle here. As you're hunched in this position, you're also going to be tight through your lats. So remember, your lats attach and they come up and through at the front here. So if you're tight and forward, your lat muscles then become tight here. And that's when you try and move the arm up. You then start hinging because you haven't got the length. So you can see my lat muscle here and it's coming all the way down through here. You will find that it's not just one thing. And obviously we talked yesterday about your upper tummy being tight as well. So for start points, look at Pec Minor, look at traps and interlevator scap, which is that sort of section through there. Look at the long extensors in your spine and across the rhomboids through here. Some breath work where you're taking a breath in and you're trying to get the movement to come up and the movement to come down. So as you move, the movement helps you, and hopefully they will give you a little bit of relief, and at least it gets you out of this position and it starts to bring you back into this position. One thing I do tell my clients, I'm just going to move this down a little bit so you might be able to see my hands if I stand on tippy toes. So with my clients, if you're rounded and curled here, what tends to happen is your arm turns forward. So you tend to be in this position here. Rather than pulling back, which really just accentuates that, it doesn't actually do anything to help your posture. Your easiest thing to do is just turn the hands out. So I'll just lower this a little bit so you can see what I mean. If I'm here and I'm curled forward, if I just turn my palms forward, it actually brings my shoulders into a slightly more natural position. So as I'm moving, just up you up a little bit again, as I'm moving from here and my palms are forward and I'm curled, just literally palms out means I'm starting to get a bit of activity. I'm starting to get some stretch. I'll start to feel that instead of being curled, just turning them around this way is making me A, stand upright a lot more, but B, it means that from here, I'm just correcting myself with this. I'm not worried about where my shoulders are, where my chest is, what's going on through other things, what's working, what's not working. Because to go from here to here, all you're doing is creating a set of problems into hunched posture to creating more problems with the forward head neck posture and overactive traps and rhomboids, and we don't want that at all. All right, so hopefully that's given you a little bit of insight in what you can do that might work to help get some release through some of those tight tissues. Release work involves something trigger point wise. So it involves doing a bit of massage to help the muscles to relax, or trigger point to help the muscles let go. So when the muscles are tight, instead of them being able to move nice and freely, what happens is a section of them comes into a knot, and that's what we call a trigger point. By putting pressure on that knot or pressure on that trigger point, the muscles then go and they let go, and you get some length back. Stretching is about getting some pull. So what we're doing is getting pull on the tissue as opposed to pressure and release on the tissue. So the pull is through the stretch. So it's going to feel different and it's going to be different. Both are valid. Some people respond better to one. Other people don't like trigger point. Other people don't like stretching. So it depends which one works for you. Both will achieve similar things, they just do it in different ways. And then obviously we've taught pecs, traps, rhomboids, long muscles at the spine, and then also then thinking about turning the arms out to maybe help you with your posture. So hopefully that's given you a little bit of an insight into some of the things you can do regarding stiffness through the back. So, you know, it's not going to be Rome was built in a day and this is the problem. There's numerous different factors that can go into it that can cause a problem, and we're just looking at a handful that you might be able to do that can help you at home. So tomorrow we will go through a bit of movement. So what kind of movements can help you? Some of them you will be familiar with. It might be some mermaids, it might be some cat and cow in like a quadruped position, it might be some book openings, but we'll do some stuff that might be a bit more user-friendly if you are stuck in an office. So thanks for joining me today for day 3 of our stretching stiffness upper back series, and hopefully you'll join us tomorrow. Take care.